collar portion and a lower portion, and we put them specifically in specific places so that we can go ahead and let gravity kind of mobilize our SI joint. Now, instead of having these at home, most people have a pair of tennis shoes. So if you look, you can see that we're thicker on the sole here, just like we're thicker over here. So we're going to use our shoe as the wedge, and all we're going to do to use the shoe is to flip it over. So if we're looking at the high part of the wedge, or the heel of the shoe is going to be where we ask you to put the high part of the wedge, the shoe, they're interchangeable there. Now, the big part of this is getting which side goes where and where to put the heel of the shoe. That's the most important part. So this is where my assistant comes in handy. So we're going to start by finding where your pelvis is. Now, we call this our hip bone. If you come and you put your hands a little bit where your waistband is and come up, you'll feel that your bone stops and kind of lips in where you have some soft tissue there. So on Fred here, this is his pelvis. And so what I want you to do is find where your pelvis is. So that's right here. That's what we're looking for, is that spot. Now, when we use the shoes, what we're going to do, and you'll be instructed as to which side to do heel and where to put it by your PT, you're going to take the heel, the wedge of the shoe, and you're going to put it, if I tell you to put it on the top part, you're going to put it right here when you lay down. So you're going to have the heel up here on the top part. That's called the iliac crest. But on the opposite side, what you're going to do is you're going to use his tailbone. You're going to use his butt bone. We don't want the shoes to go in the very center, but we're going to take this heel and we're just going to flip it. So this time we're going to have to put the heel portion down here. Now there is a bone right down here. So if he had his booty fold here, it would be right in here. If this leg is straight, you'll feel it. So if you are trying to find this on yourself, you're going to go to where your booty stops, your booty fold stops, and kind of poke around in there, and you're going to be in that right area. And that's where you're going to want to put the heel if I tell you to put the heel on the bottom side. So to do this, you're going to have your shoes. You are going to lay down on your back. Come on, Fred. And then you're going to put your feet flat and just be in this nice, comfortable position. He doesn't look comfortable. If I tell you to put the heel on the right side on the top, what we're going to do is go heel, and we're going to put it right underneath here. Okay, so you can see that's the way it looks. And then you're going to lay on this, and you're going to let gravity do its job and let your booty just sink into it. But the big portion here is now you're going to be rolling off of it. So we have to do the other side. But on the other side, I want you to do the opposite direction. So if we have the heel up top on this side, on the other side, we're going to go with the heel on the bottom. Now, if this is a little too aggressive for you on the bottom, a lot of times what I'll do is I'll come in from the side, kind of on the bottom of that booty cheek. If it's too much for you to put the shoe up and down like that, you can take it and kind of angle it at an angle and lay on it. And what you're going to find as you let gravity go ahead and take its position, that it'll try to rotate you back where you need to be. Now, if you're having a lot of pain with this, you need to stop, but you are going to feel a little discomfort because we're trying to put you back into whack, but you have ligaments and things that have been out of whack for a long time, and so they're going to stretch and feel a little achy. But if you do feel that sensation, you shouldn't have anything going down your legs, and all you should feel is a little bit of achiness, and not in the center of the booty, but on each side of the booty. But you shouldn't feel anything in the center. If you feel any pain there or anything going down your legs, you need to stop.